There we go. We are now recording. Thank you. So yeah, we were just talking about how important it is to do your own research, and that I'm not here to tell you what to do. I'm here to help you develop your own clinical judgment, how to use your intuition, how to use these dosing guidelines as a starting place for you to figure out how to build a protocol that's going to be specialized for you. And I'm going to teach you how I do that with my patients. And you know, you're not going to become an expert after this class. Okay. So becoming an expert takes time. Building confidence in a therapy, it takes time. And during that time, if you feel like you need extra help, definitely seek out a mentor or seek out care with an experienced provider. Okay, you're not working. Let's see. Okay. All right. So just a little bit outline of what we're going to be doing. I didn't want to focus so much on all the basics of ozone therapy. There's so much information out there. I sent you guys a bunch of information to do some research, but whenever you, again, bring in something into your home, you're going to have to start explaining this to people, right? You have to explain it to your children. You have to explain it to your husbands or your spouse, to your parents, to your friends. So we're going to talk about how, a little bit about that. I'm going to give you some kind of keywords and some phrases to use when you're explaining ozone therapy. And hopefully this will also explain to you how we can use it in the home. We're going to go over dosing and specific protocols. We're going to go over the equipment, safety and side effects. We're going to talk a lot about insufflations because that's the main thing that you can do at home with this generator. And then we're going to talk about ozonated water and oil and some of the other accessories that I like to use. Okay. There's some microphones on, which it's going okay so far, but please mute your microphones if you can. And let me pop up this little chat room so I can see things going on. Okay, cool. All right, so ozone is oxygen. That's it. That's all it is. It's just pure oxygen. Instead of O2, which is what we are normally, thinking about when we think about oxygen, it's O3. So it's 3 atoms of oxygen. And because of this uneven number of atoms, it makes this a super active form of oxygen. Okay, it's a reactive form of oxygen. It wants to donate that third atom, which gives it energy. Okay, and it's energy. There's energy behind this molecule. And what do we know about oxygen? Well, our bodies love and require oxygen, okay? Every tissue, every organ is made up of a tissue, which is made up of a cell, and every cell requires oxygen in order to function. It's the most basic and vital element of life. It's the very first thing that we require when we're born, and it's the last thing that we expire when we pass away. And so oxygen is everything to human life. And so you'll see that the more we understand about ozone, the more and how it works in the body and why it's so helpful with so many things, it's because it's oxygen, and it is such a fundamental element of life. Okay. The other thing we know about oxygen is that it's very cleansing. So think about oxyboost or hydrogen peroxide. Active forms of oxygen cleanse the body. Okay, so those are very simple ways that you can explain what ozone is to people. And ozone therapy is whenever we take ozone, which is a gas. Okay, it's a very clear gas that has a very distinct odor. We know it's ozone and not just regular air. We take this gas and we apply it to the body, and there's hundreds of ways we can apply it to the body. And I like to kind of just use numbers to kind of remember things and explain things. And so when I'm explaining ozone therapy, there's 5 benefits of it. And if you can remember these 5 things, you'll know when to use ozone. Okay. So inflammation, it addresses inflammation. It addresses pathogens. So bacteria, viruses, parasites, protozoa, anything that's not like a human cell in our body is a pathogen, and ozone will kill it. So, and we'll talk a little bit about that. So any pathogen, any bacteria, any virus, any parasite, any germ, ozone will address. So inflammation, pathogens, mitochondria. So it has an effect on the mitochondria. We're going to talk a little bit more about that, which is energy. So it increases energy. Increases oxygenation, obviously, it's oxygen, and it has immunomodulating effects. So let's talk about those things a little bit more in depth. Here. Oh my gosh. Okay. Why isn't this working? Oh. Okay. Inflammation. So what is inflammation? I think we all kind of know what inflammation is, right? Whenever you cut your arm or you cut your skin and the next day it's red, it's warm, that's inflammation. And that's the inflammation that we can see on the outside of our body. But inflammation actually happens on a very wide range of severity all throughout the body, in every cell in our body. And our body is amazing. And inflammation is like key to healing. And so it's a good thing. But in functional medicine, we know that chronic low-grade inflammation is at the root of all disease. Okay, so inflammation is something that is very common. If there's pain involved, there's inflammation. If there's any sort of infection involved, there's inflammation. If there's any sort of adverse immune response, so autoimmunity, there's inflammation. Inflammation is really very common in pretty much every disease. And so think about steroid use. You know, in conventional practice, they love to use steroids because it addresses inflammation. Any acute situation, they're gonna recommend a steroid. Ozone is gonna be a natural alternative to a steroid. Anything that will address inflammation, okay? So if there's inflammation involved, ozone's gonna help. Pathogens we already talked about. So viruses and bacteria, mold, parasites, they do not have any protective mechanisms against oxidative stress. And we're going to talk a little bit more about oxidative stress in a second. But basically what it is, it's that donation of the third oxygen atom. So when the membrane of a bacteria is exposed to oxidative stress, there's no protective enzymes that protect it like there is in our red blood cells and in our tissues. We have protective mechanisms against oxidative stress because it's a process that happens in our body all the time. Pathogens do not. It melts their membrane and it completely destroys their DNA. And so this is why ozone is very effective in purifying air, purifying water. Some countries use ozone, no worries, to sanitize water. There's a lot of air purification systems that use ozone, and that's because it completely destroys pathogens. Okay, mitochondrial health is kind of, it's kind of a buzzword in this world right now, and it's because along with, kind of these other things that we're talking about, it really truly is root cause. And all aging that happens, any disease and aging, it all comes down to mitochondria and oxygen utilization. And those are the two processes in our body that are required for life, and also decline with age and decline with disease. And so mitochondrial health is big in this space, and ozone does directly affect mitochondrial health, and it's used often for people that have damage to their mitochondria, which happens with disease and stress and aging. And so we can get into the nitty-gritty of it, but just know that it affects the mitochondria, and it therefore increases energy and is helpful with fatigue for that reason. Oxygen utilization is another kind of buzzword in this like biohacking, anti-aging world. And what we understand about oxygen utilization is it kind of goes along with mitochondrial health, but it's basically the ability of our body to use the oxygen that is in there. So whenever you go to the doctor and they put the red light on your finger, they're measuring your oxygen saturation. So how much oxygen is in your blood supply. What they're not actually measuring is how much oxygen your body's using. And that's different. And so the way you can measure oxygen utilization by wearing this mask and exercising, and it measures the amount of CO2 that you're breathing in versus the O2 that you're breathing. I'm sorry, CO2 that you're breathing out and O2 that you're breathing in. And it's kind of this whole tricky thing. They can measure oxygen utilization, and it has identified that ozone does help with increasing not only oxygen saturation and available oxygen for use, but actual oxygen utilization, which is absolute key to why this is such an effective therapy. Immunomodulation is a word that means it has to do with the immune system. And so modulation is just meaning that it will increase the immune system if needed, but also decrease the immune system response if needed. It has this effect on the body where it's not like you're taking a supplement to increase your immune system, right? It's affecting it in a different way for your body to know what to do, increase or decrease. And this is really helpful with autoimmunity and also infections and all the things. So we know it increases your white blood cell counts. We know it increases all of your body's amazing chemical releases that happens and that needs to happen when you're ill, that sometimes your body doesn't do enough of naturally. So it can be helpful with that. So those are the 5 things. I could go on and on with the indications of ozone, like, and ozone is helpful with this and it's helpful with that. And it really comes down to those 5 things. If those 5 things are involved, ozone can be helpful with. So again, using your brain and your clinical judgment and really understanding what you're experiencing and what your body needs support in, and then figuring out, okay, ozone might be helpful. Then it comes down to like, how should I apply it and at what dose? And that's what we're going to talk about next. So, there's more about actually how ozone works in the body. It's not, very black and white and super like, this is exactly how, but there are a lot of things that we do know. And these are kind of some keywords. I'm trying to like save time. So I won't go super into this, but if you have other questions about it, feel free to shoot me an email afterwards. But basically ozone therapy, I hear someone's microphone's off, so please just check your microphone. Ozone therapy is an oxidative stress therapy. Okay, it's a stress therapy that produces a healing response. So similarly to how exercise is on the body, exercise is a stress on the body, and the healing response is muscle mass, right? So it's very similar to that. Oxidative stress produces an antioxidative response. And so I know that sounds probably crazy to you guys who know anything about oxidative stress. Oxidative stress has gotten really a bad rep because it has to do with free radical formation when we're talking about cancer. And so what you need to know is that ozone therapy does not produce free radicals. Okay, so it does not increase your risk for cancer. It's not that. It works in a different way. And it's amazing how it works. A little bit farther down, you see ozonides and peroxides. So these are the little magical molecules that are actually science that is what is so healing about ozone. It's whenever ozone interacts with lipids and proteins in the bodies, and the byproduct of that reaction is ozonides or peroxides. And these little ozonides and peroxides get distributed out, and they work on the NFR2 pathway for inflammation. This is what melts the membranes of the bacteria. This is how it works, is the ozonides, okay? And again, in this process, because our body's pH level, it does not produce free radicals, okay? You can look up the word hormesis. You can look up this Paracelsus, and all of these words are just basically describing therapies that take a very low dose of something that could, in higher doses, be toxic to the body. But when used appropriately with the right dose and introduced to the body, and it's a stimulating effect that happens. And that's exactly what happens with ozone, is it stimulates natural processes in our body. Y'all with me? Okay. Good, because we're getting to ozone dosing. And this is the part that can be a little bit tricky, but I'm going to try to keep it super, super simple. And it's important to know that ozone dosing is not just a single number like gamma. In the ozone world, and when you go to your ozone practitioners, a lot of times you'll hear, oh, I'm using 30 gamma, or I'm using 70 gamma, and I'm using 40 gamma. And that's really important information, but it's not the whole dose picture, because you're talking about, when you say gamma, what we're referring to is the actual concentration of O3. When you fill a syringe of ozone gas, it's not all O3 molecules. There's a lot of just O1, O2, and O3. And so with these medical grade generators, they have specific settings that output a very specific concentration, which we measure in gamma, of ozone molecules in a specific volume. So when you're talking about the dose of ozone, you're talking about the concentration, so the gamma, times volume. Someone's microphone is on, so please make sure that's muted, because this part's really important to understand. Okay. It's Catherine. I think your microphone is on. Let me see if I can mute you. Oops. Okay, anyways, so an example of ozone dose is listed here. So this is the dosing for MAH, which is a blood treatment using ozone. And this is the dosing for rectal insufflation. So we take the gamma. I use 70 gamma. The setting on my generator is 70. And I fill 200 ml up in a syringe, 200 mLs, which produces a total dose of 14,000 gamma. I forgot a zero in there. It's supposed to be 14,000 gamma. Okay, so that's the total dose of MAH. With rectal insufflation,
batteries,
we're using, someone's microphone is on. Please mute your microphone.
Okay, so we need one for the ferry and for the fire truck.
So for rectal insufflation, we're using this, in this example, we're using 30 gamma, which is the concentration, up to 400 mLs. So 30 times 400 is 1200. And that's how you get the total dose. And so this can be important whenever you're trying to figure out what your protocol is. If you're trying to get to as much ozone as you would get in a blood treatment with rectal insufflation, this is how you would figure it out, okay? But for simpler terms, you don't necessarily need to know the total whenever you're figuring out what to do. You may just want to really know, what setting am I going to use, which gamma am I going to use today, and how much am I going to use. And that's in the next couple of slides, I'm going to show you what that looks like. If I can see who's not muted. There we go. Perfect. Okay. So everybody wants to know what dose to use and what protocol to use for what's going on with them. And a lot of practitioners will not share this information. And it's because it's this keyword bio-individual, okay? It's really important that you are asking yourself the questions and really coming up with a protocol that best suits you in that moment. And so I can't tell you what that is, because I don't know like your whole story. I don't know if you're a very sensitive person. I don't know, you know, what all you have on your plate. I don't know what other you need to know really the whole picture. And so what I want to teach you is how to use your clinical judgment to come up with your own protocol. And the way that I do this with my clients is I ask these questions. Okay, so what is the goal? Is the goal to decrease sensation in your nose from allergies today? Okay. Is the goal to detox your body from mold? Is the goal to support your child through an ear infection to prevent antibiotics? Okay, all of these are very different. And so it's going to come up with a different answer for me, right? Is this an acute situation? Is this something that we're like you're sick now and you need symptom relief and you've been dealing with a short amount of time? Or is this a chronic situation? So all of these questions you should be asking yourself. What's the goal? Then what support is needed right now? Okay, so think back to the benefits of ozone. Am I dealing with inflammation? Do I need anti-inflammatory support? Am I dealing with a pathogen? Do I need detox support? Am I dealing with fatigue today in this moment? Am I dealing with fatigue that's chronic? So what support do you need right now? And maybe it's not ozone. Maybe when you're asking yourself these questions, it's rest, it's hydration, it's something that's not ozone. So it's important, again, to ask these questions every day. And this kind of goes along with the next question, which is how stressed is the system? And this is something that I don't ask my clients, like, how stressed are you today? This is something more that I kind of will pick up on. And the reason why this is important is because, again, ozone therapy is a stress therapy. It's a stress on the body. And so if you are completely overwhelmed with stress, maybe doing a therapy that is a stress on the body isn't the right thing to do in this moment. So how stressed is the system? And lastly, how well did you tolerate your last treatment? And that's really important. We want to know because that's going to guide us. Do I need to decrease my dose? Do I want to stay the same or do I want to increase the dose? Okay, so with all of that being said, here is my dosing guidelines at a glance. And I'm not going to go through every single one of these right now. We will do that later. But I wanted to just kind of show you that I have it separated into 3 different levels. So on the very far left, you'll see beginner, sensitive, or child is where you would go if you fit into that category. If you're a highly sensitive person and you react strongly to things, and most of the time, if you're a highly sensitive person, you know you're a highly sensitive person. But what I'm talking about is, do you get hives or do you have hives? Do you have allergic reactions to things? Do you detox? Are you very sensitive to detoxing protocols? Are you a child? Are you a beginner with ozone and not super sure what you're doing? So maybe you should start low and go slow. This is for you, level 1. The next level down is intermediate and adult. So an adult might start here. Someone who is dealing with an acute situation who needs I appreciate the low and slow, but I'm going to need a dose today to get me through. You might start here. Never will you ever start with an advanced or aggressive therapy or dose, okay? I don't recommend doing that. That's why it's at the very bottom, and that's why I call it aggressive and advanced. You work your way up to this dose, always, in my opinion. Okay, so then the next column over is going to describe the application. I have MAH on here, which is a blood treatment, which you do not do at home, but I have that on here just for your reference. Again, I use this in the nurse training event, so I kind of borrowed some information, but this might help guide you if you are needing a more systemic treatment or an IV therapy using ozone. You might use this or take this with you to your practice to make sure that they are starting you off always with a test dose using 30 gamma at 200 mLs, okay? So that's MAH. The next column over is then, okay, I'm going to skip that column for a second. We're going to go to the next two columns. These are the two columns we talked about with ozone dosing. So you have concentration and volume. Okay, so the setting column that's in the very middle, this is very specific to the type of generator that you have. This guideline is a guideline for this Simply O3 generator. Every generator has different settings. So if you do not have the Simply O3 generator, then you will have to mark through this column and personalize it to whatever generator that you have. Okay, don't worry, I have the next column over tells you the concentration. So what you'll do is you'll look on the chart of your generator, which this is another type generator that I have. Every generator comes with a chart that will tell you the gamma is in the middle, what we're trying to get to, and which settings to use to get there. Okay. So that's how you use the dosing guidelines at a glance. The other part of a protocol is to know how often to do the insufflations or whatever, those in therapy, and for how long to do it. Okay. Again, always use your clinical judgment. Work with an experienced provider if you can't understand and know what to do for yourself. And if you experience a Herx reaction or a detox reaction, which we will get into in a little bit too, take a break. Decrease your dose and decrease your frequency. But this link here will take you to Doctors Ozone. Is a resource. It's a website, I think, but it's run by the people who own Simply O3. They have an educational platform for home users. It's and their protocol and guide to basic ozone therapies is linked here for you. And let me open this file to make sure it works. But I pretty much follow their same outline of protocols for frequency and duration. Dosing might be a little different. I tend to be a little bit more conservative or aggressive in certain things. So it might be different in dosing, but as far as the protocol goes, as far as frequency and duration, I do like what they have here. So there's a low and slow approach. There's the standard cycling approach where, the first week you do this, then the second week you do this, and the third week you do this. And so I do think this is a really great resource, and I pretty much follow this with my patients. So that is there for you to figure out a protocol that works best for you. Okay, so let's talk about the equipment. How are we doing on time? Not super well. Okay, gosh, I'm gonna have to go through this. I wanted to put 4 different companies on here to talk about briefly because I'm not married to any at all company. And I just want to share with you what I use and what I use with my clients and what I teach well. And these are my top 4 favorite ozone generators. Longevity is kind of like the grandfather, the gold standard, longest standing use ozone generator for medical use. Dr. Frank Schallenberger backs this company 100%. And he's the godfather of ozone in the United States. So I use the longevity for my IV therapies because quite honestly, it's the only thing I've ever used, and I'm kind of a creature of habit, and what works well, I don't want to change. So I use my longevity for that. There's a lot of things I don't like about the longevity. It's not super user-friendly. It's very loud, and it's kind of ugly. So not my favorite. It's a great piece of equipment. It's also very expensive. And also the company isn't, sorry, longevity, but your customer service isn't very great. So that's longevity. O3 Elite is PromoLife. So promolife.com is a website where you can purchase an ozone generator, and I love their accessories. So their ozone generator that I like, the one that I like, is called the O3 Elite. It's very similar to longevity. It has a lot of different wide range of dosing options, which is helpful for practitioners. It's more quiet and it's more sleek. And so I think for my next venture, I'll probably purchase the O3 Elite, and I do like that option too. And sometimes people do buy this one for home use, but it is more difficult, I will say, to teach on. Everybody wants to know about the Crucial 4 ozone generator. I'm almost ready to demonstrate for you. So I love Crucial 4. I think that they are a great company. I love their supplements. Charles is amazing. He knows everything about ozone, probably more than I do. He created an ozone generator that I think is really cool. It's like all quartz. It's like this cooling technology, which I don't know, I don't know. It's more expensive. It doesn't come with all the things that you need. It's not super easy to teach on. And I'm sorry, Charles, I love you, but it's not super sleek and very nice looking. So that really makes a difference for me. Like, I feel like it needs to be easy to use and easy to have out and easy to teach on. So anyways, I love the Simply O3. I've been using this one at home for years. I trust them a lot. The company themselves, I know Micah, I know Tim, and Kim is really great. I've learned a lot from her, and I mean, the company itself is just really good. Amazing customer service. Their website's easy to order from. Like, they sell everything in a kit. So when you buy the complete kit, there's no guessing. Like, you have everything that you need to do all the things, which sometimes it's kind of a lot of things. So, yeah, and the name really says it all. Like, it's super simple to use. And I'm going to show you a little bit what I mean by that. As far as the oxygen tank goes, use industrial grade oxygen. It's what we do. It's what everybody does at home. There is an option for medical grade. If you have the ability to get your hands on some medical grade oxygen, wonderful. Just make sure that you have a medical grade regulator, which is the little, you can't see it super well, but it's the little piece that goes on top of the oxygen tank that hooks, that like is everything. Like, it does the settings. So, and it connects to the machine and it connects to oxygen. So the regulator is super important. And most home generator kits come with an industrial grade oxygen tank regulator. So if you plan on using medical grade, just make sure that you purchase the regulator that goes with the medical grade oxygen tank. I don't think it's necessary to do that. It's just way easier to get industrial grade oxygen. You can get it from any local welding supply store. Sometimes it's not easy. I would call ahead and just make sure that they have tanks available. Sometimes you have to rent the tanks. I would, little tip, is I would not tell them that you're using it for ozone. A lot of people have a misunderstanding about what ozone is. And so sometimes they can be a little weird about it. So, I don't condone lying, and I'm not good at it. So I think I've just kind of dodged the question, or been like, I'm an artist, or my husband sent me here and I don't really know what I'm doing. So anyways, that's how you get the oxygen. When you purchase your generator, it does not come with an oxygen tank. So just so you know, there's an added expense. Most oxygen tanks, if you purchase one, cost around $100 to $150. To refill the tank, it's about $10, super cheap. It lasts a long time. So, I mean, I feel like my oxygen tank at home I've had for over a year and it's still good. So as long as you don't accidentally leave it open, it will last you a long time, and they're cheap to refill. And then where to purchase all the accessories, you can purchase them from Simply O3's website. Honestly, I buy my kids stuff from Simply O3, all their bottles and stuff, but all the little accessories, I go to Promo Life. And they have a lot of really cool things. So yeah, the more you get into this, the more things you're gonna collect. Kind of the fun part about it. Safety. So real fast, ozone is very safe. What you don't want to do is breathe in a large amount of ozone, just like you don't want to breathe in a large amount of water. Okay. So just because water is damaged, toxic to the lungs doesn't mean it's a toxic thing. We require water in our life. Same thing with ozone. Do not breathe in ozone. It actually would take a very high amount of ozone. It says a concentration of 20 gamma over a minute is what's required, like what they've deemed as what would cause permanent damage to the lung tissue, which is basically impossible, because if you were to breathe 20 gamma for 1 second, you would cough really intensely. And yeah, that it's irritating your lungs, but it's not damaging your lungs. It would take a whole minute of 20 gamma to cause permanent damage. So yes, it's irritating to the lungs. It's not going to kill you. It's not fun. What you want to do is you want to have oral vitamin C on hand, and you're going to take oral vitamin C, 2,000 milligrams every 2 hours until your symptoms reside, and you'll be just fine. They also have ozone destruct devices, which are really cool. It's filled with, I think, like carbon crystals or something, and iron crystals. And so what happens is any ozone that's escaping and you have the destruct attached, it'll convert it back to oxygen in the air. So we're not breathing it in. So these are all things to prevent accidental inhalation of ozone gas, which is basically the most dangerous thing about ozone. If you are an asthmatic, or if you have an asthmatic child, if you have a history of bronchoconstriction, reactive airway disease, or chronic lung disease, be extra careful. This can throw you into a storm that will be hard to get out of. So those people want to take extra precaution. The other thing that we warn people about with ozone therapy, and this is super important. So I know we've gone over a lot of information and I'm running out of time of the actual demonstrations, so I'm really sorry, but this is really important. It's called a Herxheimer reaction, and this is a detox reaction. This is what happens when our body kills off pathogens and your immune system sees it, and then it responds to the die-off. And this is, this is a healing thing that's happening inside of you. But what I've learned from my patients is that, like, what am I trying to say? When you experience these Herxheimer reactions over and over and over, and you keep pushing yourself, it can be dangerous. And the reason why is because if you're having a Herx reaction, what's happening is your the ozone's killing things off, and then it's going off and producing all more die-off, which is amazing and great. But if your body isn't getting rid of it fast enough, then it builds up and it causes worsening of symptoms, and you can throw yourself into these storms that are hard to get out of it. It will have you, it could possibly create mast cell activation, which is when your body is inappropriately responding to everything with histamine, and it's not fun, and it makes things really difficult, and you have to go super slow. So it also can almost damage your limbic system and your adrenals. It's like way too much for your limbic system. And these people will get stuck in fight or flight, and it's really hard to get out because they're just too full of toxins. Their drainage pathways aren't open. They're not in flow. They're killing off too much before their body can get rid of it fast enough. And so if you're having a Herxheimer reaction, it's because your drainage pathways are blocked, and you need to slow down. You need to take a break. You need to work on your pathways, and you need to bind so that your body can catch up, and then you can start again. There's mild, moderate, severe. I'm okay with a mild Herx reaction, which is where someone may experience fatigue, maybe headache, maybe just feeling icky the day of the infusion. They wake up the next day, they feel great. Okay. Make sure you're taking your binders, make sure you're taking minerals, and you're supporting yourself, but I'm okay with a mild Herx reaction. A moderate or severe Herx reaction lasts longer than 24 hours and prevents you from doing the things that you need to do. So if you experience things that are preventing you from doing the things you need to do or last longer than 24 hours, this is a moderate to severe Herxheimer reaction, and you need to take a break and work on your drainage pathways. This is the drainage pathway funnel. I'm going to probably have to spend a whole nother hour talking about draining and binding, but just so you have a visual, your cells dump toxins into your organs and your tissues. Your organs dump toxins into your lymphatic system, which dumps into your liver bile, which then dumps into your colon for your body to get rid of. If there is any blockage in any of these things, which there's a number of reasons why that can happen, they start spilling out the side here. You start seeing skin issues, kidney, stress, lungs, and all these things. So this is drainage pathways, super important. Here's some activities that you can do to work on drainage. And Jessica Aldridge is one of my really good friends. She's really big in this space of detoxing and drainage pathways and binding. And so she gave me some really good advice that your body needs to be in a parasympathetic state in order to drain and in order to detox. So that's really important. But here's a little bit of information and some information on some high quality binders. These are the ones that I use in practice and really recommend over things like charcoal and bentonite clay and all the other binders that are out there. These are the best ones. And I'm gonna have to talk about more of that on a different day because I want to get through some of these insufflations. Okay, so what is an insufflation? Insufflation is how you say it. And basically it's just whenever you take the ozone gas and you put it into a body cavity. So you can put it into your nose, into your ears. You can breathe it in through your lungs as long as it's bubbled through oil. You can insufflate into the rectum and in vaginally, and that's pretty much it. You can also inject it into joint tissues, joint spaces, muscles, subcutaneous tissues, and all that. So most of the insufflation therapies are considered a localized treatment, with the exception of rectal insufflation and vaginal insufflation can have a more systemic effect, meaning the ozone gets absorbed into the bloodstream through the rectum and vagina, and then the blood carries it out through the body, and you're having a more systemic effect of ozone while also having a localized treatment. And whenever we're talking about ozone therapy, the closer you get the ozone to the actual tissue of what we're trying to do, the better. So if you're having nasal congestion, do nasal insufflation. If you're having ear pain, or if you're having sinus, or if you're having throat, neck, ears is going to be helpful. Anything in the eyes, nasal is going to be super helpful with. Brain fog, nasal, ear, close to brain as well. So basically we're just trying to get the ozone as close to the tissue as possible. Here's some indications, different reasons to do different applications, which you can probably read on your own. And then the next couple of slides tells you which equipment you need for each type of insufflation and the gamma and dosing recommendations for each type. So there's ear, breathing in the ozonated oil, rectal, vaginal. Here's ozonated water. And then I'm gonna go over this slide, and then if you can stick around, I'm going to demonstrate how to use this machine. But I know we're getting close to time, so I just wanted you to know that anybody who came to this live thing or watching it recorded, if you need extra support, if you feel like you need someone to sit down with you and go through everything and figure out, what's the best protocol for you, we can help you with that. I do charge for my time on that, but because you already got a lot of it today, I'm offering $50 off of that. It's normally I think $150 for that teaching consult. You can book that just through my booking link, and I can sit down with you and we can talk about you and come up with a protocol that's best for you. And because you attended this class, you got a lot of information already. I would love to offer you a discount. And just as long as you sign up by May 27th, it's just kind of hard with, planning all the things. And I have summer vacations and stuff planned. So yeah, just go ahead and book that. And you can, in the notes section, put the code masterclass so that I know you attended this class, and we can get you that discount. And then If you're interested in purchasing the home generator, you can save 10% on Simply O3 is the only company that I have like an affiliation with or a discount code with. You get 10% off, and that's my code, Darrah. So I think it's time. You ready? Okay. I'm going to demonstrate ear insufflation first because I have the Lindley here, and I'm probably going to sit right here. So, okay. I know. Let me hold you in just a second, actually. Mommy, you want to sit right here? Okay, so I have my dosing guidelines like printed out and laminated. And if you book a teaching consult with me, I give you like the PDF version of this, easy to print. And if you're in person, I'll give you a little laminated thing, but it's nice. So what we're going to do is we're going to go, she is a child, and we're going to do some ear insufflation on her today. And so ear is setting 4, which is perfect. That's what mom has been doing at home. And if you don't have a Simply O3 generator, you're going to be looking to find the setting that's going to reach 20 gamma to start. And we're going to do anywhere between 30 to 60 mLs. How many do you normally use for her?
I usually do a full syringe in each ear.
Full syringe in each ear. Perfect. You probably started off using half and then felt comfortable enough to increase all the way to 60 mLs. Perfect. So there's 2 ways to do ear insufflation. I really like the ear insufflation by injection. It's easier. There's less chance of you inhaling the gas. The only thing is you kind of have to do it more often. But if you have a home generator, then that's okay. And that's perfect. How often do you usually do it when they're sick?
When they're sick, I'll do it like once a day.
Okay.
For up to like 5 days, and then I'll give them a break just based on their symptoms.
Yeah. Sometimes, in rare occasions, it can cause itching of the ears. So if you experience that, that's a sign that you're doing too much. My boys are a little bit older, 7 and 4, and so I usually do it like twice a day with them. You can purchase these little like silicone tips at promolife.com. It makes it really easy for kids. And the trick is you have to cut it to size, I've realized. Oh. So in order to fit my syringe, I just have to cut the very tip off. And then it will slip on the tip of the syringe there and makes it super easy for application. Okay, gosh, I'm gonna try to bring this a little bit closer. So with this machine, on the top, there's a chart. Okay, so but on my dosing guidelines, I already know that setting 4 is gonna get us as close to 20 as this generator produces, 23 gamma at setting 4, okay? So first, what we're going to do is we're going to turn on the oxygen tank to setting 4. And this is why I love Simply O3. They make it so easy with the settings. Okay, so you just do setting 4. So right now what's happening is oxygen is running from the oxygen tank through this tube into the O2 port here on the generator, and oxygen is coming out. But once I press this on button, it's now converting the oxygen that's coming in, the O2 that's coming in, to O3 at a very specific concentration, which in this case, it's 23. So I'm gonna let that run for just a second because it takes a couple seconds to start converting. And then I'm just gonna attach the syringe to the output port here by screwing it on. Super easy. You don't wanna screw it on too tight because it will get stuck on there. So just tight enough for it to start filling. It will fill up pretty fast. Press off. Unscrew, and then keep your syringe upright because ozone gas is heavier than the air. And so as long as the syringe is upright, the gas will not escape from it. Just make sure you go back and you turn your oxygen tank off. Otherwise your oxygen will run out. So now this is filled with oxygen and ozone. And kids don't always participate really well. So it takes practice. It sometimes will take 2 people, but what we're gonna do is, so I'm gonna skip the massage and I'm gonna show the massage later. Okay. It's helpful to work on the lymph nodes here to kind of open up the eustachian tubes, get lymph movement going, and then do the ear insufflation. But because it's like an awkward setting right now, I'm probably gonna skip that part. And I'm just gonna do the insufflation. So hopefully y'all can see. What we're gonna do is we're gonna kind of gently pull on the earlobe to where you're creating space for the syringe to fit in there. And then you're gonna take an angle. Kids' ear canals are at an angle like this typically, so a little bit pointed up like so. And you'll know if there's any resistance at all, adjust the angle of the syringe. Okay, so we're gonna do this kind of fast. And you just want to set it in there to where it's not like completely.
What is she doing?
I know.
What's she doing? It's okay.
You don't want to have any resistance because there is a. Just kind of set it in there. It's okay if a little bit of it escapes.
It's okay, baby girl.
You don't want to bust the eardrum, so don't get it in there too tight. This is real life.
Yeah.
Oh, and sometimes you have to do it in pieces, and that's okay. You want to use the ozone gas will stay for about 30 minutes before it starts getting back to oxygen, so you have time.
Here.
Thank you, Lindy. Say thank you. Thank you, Lindy.
Bye.
Bye. Okay. So with ear insufflation, whenever you're doing it to yourself, this is why I have a mirror right here, because it's helpful to kind of see yourself while you're doing it. I'm gonna do it on myself so you can see that too. And for me, for ears, I'm gonna do setting 6 because I'm an adult and I've done this before. And setting 6 on the generator is 30 gamma. So what am I doing first? Turning on the oxygen. Oxygen's running through my tank now. Once I press this power button, it's converting it now to ozone. I'm gonna give it a second. I'm gonna screw this syringe on very, very loosely, let it fill up. I like to use ozonated oil, but you can use any oil to do the lymphatic massage. Ozonated oil is amazing. Obviously, I think it's amazing because ozone gets absorbed into oil, and the oil can preserve the O3 molecule from converting back to oxygen. And then when it is rubbed on skin, the heat activates it to be released, and it can be absorbed through tissue. So that's cool. You kind of get like a localized ozone treatment using ozonated oil. And whenever you have congestion in your lymphatics, it can be helpful with moving toxins and moving lymph and kind of having a localized detox effect there. So I like to use the ozone oil. And what I do is, let me use this camera as a mirror, but I'll start just kind of at the base of the earlobe here and gently with like out of 1 to 10, a pressure of like 2 to 3. So very, very light touch. And just kind of these sweeping motions. You can go up or down, right? So kind of against gravity is nice. And if you feel a nodule, if you feel any lumpiness, which there's a set of lymph nodes here, there's a set of lymph nodes here, and then another set here, okay? So at any point, if you feel any lumpiness or congestion, you can take the inside of your finger and with gentle pumping pressure, just kind of do this like little milking, and it feels really good. And you will almost instantly feel drainage. Just like this, about 8 to 10 times. And then put on the tip. I kind of lean my head over a little bit, pull out my earlobe, and just to where it's comfortable, but not like in there really hard to where it's too much of a seal, like just kind of gently place it in there and then slowly push it in. And really you don't feel anything except sometimes it gets warm. And a lot of people will say, oh, it's hot, it's warm. We don't really know why that happens. I kind of assume that it's like it's ozonating the earwax. So that might be why. It might be having an effect on there is a lot of vascularity in the tympanic membrane. And then I just kind of hold it here to let it trap in there for a minute, kind of move that around and then work again here. So that's one way to get it into the ears. The other way to do it is with a modified stethoscope. Will you grab me the stethoscope? Sure. The one that has like the silicone arms on it. So if you were wanting to do like a high dose of ear ozone, or like and you just want to like sit there with something in your ears, then you can use this option. And you want to use the water bubbler with this option, because if you were to just connect this modified stethoscope directly to the generator to your ears, you're going to have extreme itching in your ears. So using the water bottle in between the generator and the stethoscope helps hydrate the air as it's going in. And so that's really important. So when you purchase the whole complete kit from Simply O3, you get the Ozone water bottle. You can use it for ear insufflation, or you can use it to make ozonated water. So there's two purposes for this. And I really like that they include the filter in line so that you never forget, because what happens is if you leave this tubing connected to the generator for too long, the water will siphon back and go into your generator and damage your generator. So it's really important that you have that filter there. And Simply O3 is in line, but other companies, you purchase it separately. It looks like this sometimes, and you just kind of connect it to the end of the tubing and connect to the generator to protect your generator from water damage. You'll notice on this water bottle that there's two arms at the top, or two ports. There's a center and a side arm. The center port is what connects to the stem that bubbles the ozone through the water. At the very bottom of this water bottle stem is a stone. And so the reason why we use a stone is because it disperses the gas in very small molecules for better absorption. So the stone is really important. It breaks really easily, so just be really careful. So when you're setting this up, again, super easy, you just kind of have to get used to it, right? So the center port, or the center arm, the one that has the inline filter, will connect directly to the ozone output port on your generator. And if you have Simply O3, it's located right on the front there. Oh my gosh, I'm gonna drop my computer. This is the ozone output port. And all the connections for Simply O3, which I really like too, are these lure lock connections. There's a male and female end. As you can tell, there's a little port that sticks out. This is the male end, and that just screws right into the port. Okay, so we have the center port connected to the generator, and now the side port has a female end, female lure lock end. And this is where we're going to connect the stethoscope. So the stethoscope is a modified stethoscope designed for ozone. It has ozone resistant materials in it, okay? The end of the tubing has the male lure lock, which will connect to the side arm via male-female connection. Most generators use this. Some generators use a different type of connection, but it's pretty much all the same. Okay, so now we have oxygen that runs through the generator, that runs through the center port, down the stem, into the water. The ozone gas then escapes and is hydrated, comes out the side arm and into the ears. So when we're looking at our dosing chart, I have this set up on the advanced and aggressive because it is going to be a very high dose of ear ozone. So you'll find this on the very bottom of the dosing chart for under ear. And instead of a volume, like 60 mLs, a syringe full of by the way, these syringes come with your kit. It's measured in cc's or mLs, same thing. ml is cc is same thing. And the volume is 60, okay? So that's what we did before. We did 60 mLs in each ear. So instead of measuring it in a volume of mLs, the way we measure the volume in this application is by time. Okay, so how long are we gonna let it run? Okay, that's the volume of gas that we're gonna use. So it says settings 6 to 8, which is gamma, 30 to 40, very conservative dosing. Sometimes you'll go to an ozone place and they'll blast you with like 70 gamma, and it can be really intense. So just be careful. I like to stay around 30 or 40, and I don't go higher than that. Again, there's a lot of vascularity in the tympanic membrane, and so it can be a systemic treatment, especially for anything head or neck. So like if I had brain cancer, maybe I would do a higher dose for a little bit longer. But if I have an ear infection and I need a little bit more than just this, you know, I'm going to stick with about 30 to 40 gamma for about 20 to 30 minutes. Okay. So I'm going to go over to setting 5, which on this generator is so easy. You just move the regulator to the number 5. And then you press the power button, because now it's ozone and not just oxygen coming through. And you'll see that it'll start bubbling. That's how we know it's on. You see the bubbles through the water. And in my ears, I can hear a little bit of like, kind of like you're in the ocean. Okay. You set a timer, and it's really easy. If you start smelling ozone, just make sure you have some oral vitamin C around, because sometimes it leaks like through this little connection here or out through your ears. But I like this setup. I got this from, I think, Simply O3. So when you turn it off, make sure 3 things. You turn off the power button, and you turn off your oxygen. And then you always disconnect your accessory. So 3 things when you're turning off your machine. Disconnect your accessory, turn the power button off, and turn off your oxygen tank. If I didn't disconnect my accessory and accidentally left it connected, that's when you get the siphoning of the water out of the stem and into the tubings. Luckily, this filter is here, so just be careful. So because I already have this set up, I'm going to show you ozonated water next. Very similar setup. Instead of the side port connected to the stethoscope, which is going to get you ozone into your ears, we want the ozone to stay in the water to be absorbed. So we're going to connect it the same. We're going to connect the center filter line to the ozone output port. And on the side, instead of the stethoscope, we're going to connect the D-struct, which also comes in your kit. But if you purchase a different generator, make sure you also purchase the D-struct. And this will have a connection that will just connect directly to the side port here, super easy. So now what we're getting is oxygen, O2, running through the generator, forming it into O3, going into the center port of your water bubbler stem, ozonating this water. Any escaping ozone will come out the side port here and into the D-struct. On your dosing guidelines, you will see that the volume is also measured in minutes. So for a beginner, you're going to only ozonate the water at a low setting between 30 and 50 for about 20 minutes. Work your way up to a higher strength ozone water. You can use ozone water for so many things. I think I have a post on this on my blog, but you can drink it, Start low and go slow. It will detox you if you drink it every day. Make sure you drink it on an empty stomach. Make sure that you store it in a glass water bottle with a very tight lid and in the fridge. The colder, the better. It'll last longer. Ideally, you want to consume the water within 30 minutes. If you keep it airtight and in the fridge, maybe up to 24 hours. I mean, always drink the water. It doesn't go bad. It's just, you're going to have a very purified water, but it's not going to have a high dose of ozone if you wait too long to drink it. Okay, we're almost done. While we're on the talk of bottles and quarts, I'm going to show you the ozone oil bubbler. And this is what we use for lung treatment of ozone. Again, you don't want to breathe in ozone directly into your lungs. But if it's bubbled through oil, you can breathe it directly into your lungs. And that's because the oil entraps the particle and it protects your lung tissue from the oxidative stress, and it will deliver the ozone directly to where it needs to go to have an appropriate response in the lungs. So oil, and you want to use organic olive oil to do this. You want to fill it up to at least cover the bulb here. And once the oil starts getting really light in color, it's time to move on and get new oil. That oil is technically ozonated oil, but it's more of a lightly ozonated oil. You can use it on your skin. You can use it, I mean, you can consume it. You can do all kinds of things with it. But it's not going to be like a highly concentrated ozonated oil like you get with a high quality product like Pura 3. These oils have been ozonated for days, probably 30 days or longer. I don't recommend making ozonated oil at home. It's a fire hazard. These generators get really hot when they're left on for a long period of time, and there have been a lot of house fires of people trying to make ozonated oil. So for that reason, just purchase the ozonated oil. It's easier, and this is a really high quality product. I really love Pura 3. Their ingredients are really clean, and it works. I know it works really well. It's worked wonders for me, so it works. So I like it. Okay, so you'll notice on this one that there is a filter in the line, but my tubing is disconnected, and that's because I wanted to show you guys. It's always a good idea to have extra silicone tubing on hand. You kind of go through this. It gets gross after a while. Sometimes if it like siphons oil or siphons water back, you'll want to replace it. It's always good to just have extra tubing on hand. You can purchase it from promolife.com. You can also purchase extra lure locks. So these are like male, female ends that just, you cut your silicone tubing to size, and then you just stuff the little connector in there, and you can make whatever connections that you want. So I always have a double female end on hand, because you just never know what connections you need sometimes. I always have a double male silicone tubing on hand, and then I always have a male female silicone tubing on hand. So right now I'm trying to connect the end of this filter to the output port on my generator. And so I need to connect here, I'm going to need a female end. And to connect here, I'm going to need a male end. So I'm going to take my male, female. I hope I haven't lost y'all. It's really not difficult, I promise. Okay, male, female. So the male, this is a male end. So I know I need a female end to connect to it. Screw that on. It's always a male connection to the port here. Connect that. So now our center port with the filter is connected to the output port on our generator. And the side port is going to be connected to the nasal cannula. So you can purchase this on Simply 03 or Pure Promolife. They're very cheap. So buy a bunch of them because you'll not want to share this with people, I'm sure. They get gross. I think they're like $2 each. So just buy several of them. The ending is a connection, a male connection, which will connect to the side port here. So now we have oxygen running through our ozone generator, which will turn it into ozone, which will then bubble it through the metal stem, the middle port, center port of your water, your oil bubbler. The ozone will bubble through the oil, come out the side port and through your nasal cannula into your nose. One thing to note, you cannot use your water bottle for oil because remember I showed you the stem has a stone at the end for the water, where the oil, you can't really see it, but it's more of a bulb, a glass bulb. The oil will damage your stone. So sorry. I've had people try to make that shortcut, and unfortunately, what you can do is just purchase the oil stem and use the same bottle. You'll just have to clean it out often. To me, it's worth it to get both, but it's an investment. But anything to do with lungs, this is so helpful. I've been doing this with Jackson all week. He's had a cough and it's like a game changer. So you just put in the nasal cannula into the nares, tuck this behind your ears, look like a little hospital patient. And then when we look at our dosing guidelines for lung, I'm an adult, so I've done this before. So I'm going to start in the intermediate level. It says setting 6, which is 30 gamma for 20 minutes. An aggressive dose, like if you're super sick and you need it to like do its thing, maybe be a little bit more aggressive. This one's okay to be a little bit more aggressive with. Lung is going to be up to 40 gamma for up to 30 minutes. So 30 to 40 gamma for 20 to 30 minutes. Okay. So on this generator, it's setting, I'm going to do setting 7. So again, go to your oxygen tank here, roll it to number 7. You'll notice that right now you can already see the bubbling happening in the oil, but it's just oxygen until you press the power button. Okay, now it's ozone. Now you start your timer for 20 minutes. And you're not going to really feel anything. That's normal. The flow of oxygen is so low that it's not like it's like blasting into your nostrils. You might smell olive oil, but if you're not super congested, take deep breaths in through the nose and out through the mouth. That's breathing in ozonated olive oil. Again, when you turn it off, 3 things: oxygen off, power off, disconnect your accessory.
Boy!
I love it. Okay, we're getting through this. What's next? I'm going to show y'all how to fill I already showed you how to fill a syringe. So for rectal and vaginal ozone, you're going to always want to start off low and go slow because it's a systemic treatment. So always start in this beginner. You know, you have this machine at home now. So what's the rush? Okay. You're probably going to be doing this every day at first. So start low, and with low settings, the volume is 60 mLs. So initially you're going to use the syringe because it's 60 mLs in the syringe to fill up your desired concentration, your desired ozone amount, right? The way I showed you earlier, filling the syringe. And then you're going to connect, which if you buy the kit, again, it comes with all these things, but you're going to need a catheter. So you're going to connect. This catheter, again, is a male-female connection. It just screws directly onto the syringe there. Okay. And then this is the catheter, y'all. It's so small. And we're all adults here, and I'm a professional. So we're going to talk about this. This is so easy. It's seriously, if you've ever done an enema, it's like way easier than an enema. The tubing is tiny, like it's very, very tiny. And you'll see on here that it's marked with this black line here. So that's the minimum amount of length that you want to insert it, especially for rectal insufflation, like that's all you need. And then you want to use a little bit of lubrication. You want to use a little bit of lubrication maybe on your fingers to palpate the area, you know, make this like a little self-care ritual, and, you know, like be calm and relaxed and really, I usually just sit on the toilet and do it, easy access, and you just kind of palpate the air. You don't necessarily need to lay down. You can if you feel comfortable enough to do that. You know, they say if you lay on your right side, it'll get to your liver a little bit better, but ozone gas is different. It's not like an enema where it's like filling up the space, right? You will feel a little bit of filling, but it's way less than an enema because it's not a fluid, it's just air. And so, yeah, so you'll palpate the area, you'll insert the catheter up to the black line. If it's rectal, good. If it's vaginal and you start pushing the syringe and you start feeling the gas escaping like automatically, you got to push it up a little bit farther. If it does escape, that's okay. Actually, ozone, once it comes in contact with the tissue and it's like warm and it comes in contact with it, the reaction is nanoseconds. So it's very fast. You don't have to like hold it in for any amount of time. It might be good to like kegel a little bit, you know, just kind of keep it up, just kind of like I close the earlobe just to kind of keep it there for as long as it can, but you don't have to like try to hold it in for as long as you can. So whenever you have the syringe, you just gently push the plunger at a rate that feels comfortable for you, and you'll know. Don't want to go too fast, don't want to go too slow. It's probably wise to evacuate your bowels before doing a rectal insufflation. I have had some clients who have ulcerative colitis and they have bleeding. It is safe to do rectal insufflation while you're bleeding. Just be careful in that, you know, you don't, you want to use lubrication. Don't be forceful with the catheter and all that. Just be gentle with the tissue. And there will be sometimes backflow into the catheter, and that's okay. It's more helpful if that happens to you to use a syringe, because that way you're just like pushing positive pressure all the time. With the bag, sometimes it's hard. Like if you let go for a second, things will flow back. So that's why it's important to evacuate your bowels first and just be cognizant if you have bleeding that might happen, and that's okay. You know, it'll work wonders still. Once you increase your dose for vaginal and rectal insufflation, so you're in these, your volume increases to 200 to 400. So instead of filling up a bunch of syringes, they make these ozone bags, which are really helpful. And the way that these work, they have a chart on the bottom, but just ignore that and use my dosing recommendations. But what you do, if you want 200 mLs, you pinch it here and it fills the bag, just this top section. And if you want 400 mLs, you pinch it here and it fills this top section. Never have I ever done 750 mLs. It's just a lot of gas, and it creates a very, very high dose ozone dose, which isn't necessary. It's not necessary to do high doses of ozone. Low and slow. So in order to do this method, very similar to the syringe, you're going to pick your dose and your setting. And so I'm going to choose setting 5, which is about 30 gamma. So we're going to turn on our oxygen tank to setting 5. Then we're gonna press on our power button. We're gonna let it convert for a second. Also notice on the bag that there's this clamp here. So to open it, you pop it open like this, pinch it to close it. So we're gonna open it, and then we're going to, it has a male end connection, just connect it directly to the output port here and let it fill up. Again, you're just gonna pinch it off here. Once you get it fills up a little bit, just so that the volume is 400. Then when you're done, 3 things when you're done. You're going to, I'm gonna clamp this. You're gonna disconnect your accessory. You're gonna turn off your power button, and you're gonna turn off your oxygen tank. Super important. Now, this is filled with ozone. You're gonna connect that catheter to the tubing that's on the bag at the very end, has a lure lock connection, connects to the catheter there. Dip the tip in some lubrication. And then what I do is I'll insert the catheter. I'll use one hand to kind of hold it in place, unclamp your bag, and then use the other hand to just kind of squeeze it in like so, and at a rate that's comfortable for you. So not too fast, not too slow. And you'll know it feels right. I think that's it. I think we got through all the things. I look at my cheat sheet. There we go. Oh, here it is. Water, vaginal, rectal, lung, nose, ear, blood. Okay. Okay, we are way over time. Super sorry. I'm gonna go over to my chat box here. Okay. Susan, I'm sorry. Let me send you that slide deck. I'll do that after this. I currently get MAH once a week, but super interested in being able to do this at home. Cool. So I don't know what you're getting MAH every week for, but typically weekly in IVs is for a detox protocol. And at least that's what I recommend if someone's trying to be intense with detox. The frequency is about once a week. So obviously this gets expensive. You know, I don't know how much you're paying, but I think I charge $175 for MAH infusion at 70 gamma, 200 mLs. That's a typical dose. When you're doing it every week, depending on what you're trying to detox from, you may need 5, 10, 15, 20 infusions to get to where you need to be. Don't go out and do 20 infusions every week. You know, I'm not telling you what to do to detox, but I'm just saying that might be you. And so doing this at home is a cheaper option. And I talk to all of my patients about this, and everybody can tell you that I definitely recommend, if you're in a chronic state or have a chronic illness, or you have MTHFR and you know your detox isn't always going to be a thing, that you can't be on IVs forever. And having a unit at home is really helpful for maintenance. And there's just so many things you can use it for. And when you do ozone rectally, it's just as effective as doing it IV. That's what a lot of people say. Honestly, I can't tell you that from experience because I haven't done a rectal protocol myself doing that. And I have access to IVs. So I can't tell you that from experience, but everybody that's an expert in the field says it's just as effective. You just have to do it more often. There's a lot of vascularity in the rectum. There's the portal vein there. It absorbs into the bloodstream from the rectum. And you can get high doses in there if you want to, as high doses as you would with blood. You just don't have as direct of an absorption. So you just have to do it more often. But it's such a great option. And I hope I hope that I've empowered you to see that it can be easy. This is easy, okay? It's like a lot. We covered a lot of information here today, and it's thick, you know, and I'm like preaching to you that you need to become an expert in this. But I also want you to know that it's easy. And, you know, find yourself a mentor to teach you how to do this, because you can do it. What else? This is being recorded. I forgot to hit the record button. Thank you for all that. Question on oxidative stress. Don't we want to avoid that? Too much of it causes disease, right? So I talked about this a little bit already, but correct. It seems weird, right? We take antioxidants to combat the oxidative stress that happens in our body from dis-ease, or that is leading to dis-ease. And it's a real thing. But what we have learned about ozone therapy, it's like, how can something that's a potential poison to us have such healing benefits over the course of all of these decades of use? How is something that is potentially toxic so helpful? And so the answers to those questions you can find in the resource list. I encourage you to read about it. I really love this book called Flood Your Body with Oxygen. It's a really easy read for you all. I also like anything by Frank Schallenberger. It really explains this. But basically, number one, the pH of our blood is 7 or 8. And so at this pH, the oxidative stress that happens does not produce free radical formation. So it doesn't have the same byproduct as the type of oxidative stress that can happen that we're used to thinking about in our body. It's a different dose of oxidative stress, which produces a different outcome. Okay. And it's that stress response system. You're stressing the body to get a healing response. And it seems really backwards. And I think that's why a lot of doctors don't understand ozone therapy, is because of this whole thing about oxidative stress. And another thing I'm going to add is, if you know that your body is like in a lot of oxidative stress, low and slow with ozone. You don't want to tip your canoe of oxidative stress. And under safety, there is one condition. It's called G6PD deficiency. These people do not have the buffering system that we're trying to activate with this therapy. They don't have the ability to respond with a flood of antioxidants. And so high doses of ozone can be dangerous for people who have this deficiency. And so if you are getting, especially if you're getting IV high dose ozone, you want to make sure you don't have that deficiency. But otherwise, it has proven to be safe and effective. And I encourage you to do your research on that. And Marcy asked that question, and I know you do your research. And I really appreciate that question, because I know that she is challenging all of you to think about this and to do your own research and to really understand what you're doing. Because I know that Marcy does that with everything that she does. And okay, so what is the difference between ear insufflation directly with the syringe versus the stethoscope? So the difference is the dose, right? The volume. So you're getting a smaller dose with the syringe. I like the syringe method better. I think it's effective. Like, it works for my people. It's just better and easier. And I only use the stethoscope if I'm trying to get in a high dose. With the syringe method, you just have to do it more often. Like, when I was sick with the thing, I think I did it on myself like 2 to 3 times a day. But I'm an adult who's done a lot of ozone. So, you know, just be careful. I I have someone on here who has a Simply With Their generator, and they've already learned so much from me today, which makes me very glad to hear. Thank you for that response. And I'm going to send a feedback form so that I can get some feedback for you for sure. Can you drink ozone water? Yes. Do you have any info on ozone with leaky gut? So, what is causing leaky gut? That's important. Leaky gut is often the culprit to be the root cause of your symptoms. You go to a root cause doctor and they're saying, oh, you're experiencing this because you have leaky gut. All we got to do is fix your leaky gut. Well, you got to ask more questions than that. What is causing your leaky gut? Is it because your diet needs to improve? Probably. Is it because you have pathogens, overgrowth of bacteria, parasites, whatever it is? Probably. So can ozone help with parasites? Yes. Is it because you are having an immune response to foods that you're being sensitive to, which is causing inflammation? Probably. Ozone helps with inflammation. So think back to those 5. Oh my gosh, I'm so sorry. I hope that, I don't even know where I left. I know where I left off. Okay, so if it has to do with inflammation, if it has to do with pathogens, if it has to do with oxygen, ozone's going to be helpful. Again, the closer that you get the ozone to the tissue, the better. Drinking ozonated water will get it into the stomach. Don't know if it'll go much past that. Putting it up the rectum will get it to the colon and the rectum. Don't know how effective it is towards leaky gut. What I do know is that addressing all of the things is helpful, and ozone is helpful with those certain things. So I hope that answers your question. That to be said, another note, if you're going to be using ozone regularly and you're doing it often, your body will detox. If you have leaky gut and you're detoxing, that's a drainage pathway that's compromised. So working on both things. This is why in my program, and people that are detoxed with me using ozone, I have them on gut healing protocol for 4 weeks prior to doing a detox protocol using ozone and during, because we want to keep that gut intact. And it's kind of like chicken egg, right? It's like ozone helps leaky gut, but you need to address leaky gut to do ozone. So it's kind of one of those things. What is your opinion on an ozone enema? So ozonated water enemas are great. It's a great place to start. I think more effective is going to be the insufflation, because it's the gas directly absorbed into the tissue. Whereas with water, it gets absorbed into the water and then it goes to the tissue. So water doesn't absorb ozone as well as our tissues do. So you're going to get less of a dose of ozone, but it's a good way to start a protocol is by starting with an ozonated water enema before rectal insufflation. So I hope that answers your question. Is VI as systemic as RI? Probably not. Rectal insufflation is known to have systemic effects for sure. Vaginal insufflation, if you have one, do it. I mean, I think it's helpful. They say it's the closest you can get the ozone to your lymphatic system. If you have anything to do with like urinary tract, feminine organ issues, that's going to be helpful. There is vascularity in our vaginal wall, but you're going to have more vascularity in your rectum. So not as systemic, but a little systemic, if that helps. Is nasal insufflation bubbled through oil safe for asthma? People with asthma need to have extra precautions in breathing in ozone. If it's bubbled through oil, then there should be no issue. just make sure it's actually being bubbled through oil. Sometimes, you know, you forget to hook up the oil and you're connecting it directly to the nasal cannula, and for an asthmatic that can be super complicated. So it can get complicated. So just make sure it's bubbled through oil and you should be good. Have vitamin C on hand for sure if you're asthmatic using Ozone at home. Yay, thank you for that feedback, everybody. Cool. Do you guys have any questions for me or for Nicole? She stuck around and is here to answer any questions about injections. I know we're like super over and now we're just talking to have fun, but Ozone injections are really a powerful tool. Our joints don't get blood flow, so it's the best way to get nutrients and oxygen to the tissues to inject it in there. And it's a very great alternative to steroids. Steroids actually, what do you always say about steroids?
Steroids can actually alter or hinder your tissue from actually repairing and regenerating.
Yes.
It stops that healing process.
It stunts growth, essentially. It's effective for inflammation, but steroids stunt growth. And what we're trying to do is regenerate the joint tissue. So with steroids, what you're doing when you're injecting a steroid into a joint is you're addressing the inflammation and you're essentially treating the symptom, but you're not doing anything to repair the tissue and addressing the root of the issue. So that's why Ozone is such a great option, because it's an anti-inflammatory, but it's also regenerating the tissue. So cool. Can you please say again which beginner at-home system you recommend? So there's the 4 that I talked about, medical grade ozone generators that on that side with the equipment that I like. My favorite one to teach on and to use at home, and the only one I've ever really used at home, is the Simply O3 generator. And this is good for beginners because it's super simple. Other generators, let me tell you what's more confusing about other generators. That's my other generator. So with Simply O3, it's a single setting. If you know the gamma is 30, then all you have to do is look at the chart and get as close to 30 as you can, and it'll be like setting 6 or whatever. I don't know if that's the right setting, but is it? And then you go to the oxygen tank and you turn it to setting 6, and voila, that's it. That's all there is to it. It's a single setting. But with other ozone generators, can be very difficult, especially for beginners, because it's not just a single setting. It's a setting plus the oxygen flow to get to the concentration. So like, no, let's this upside down. So on this generator, if I was trying to get to 30, I see, okay, 32 on here is here. So in order to get to 32, I have to pick setting 5 and then set my oxygen regulator to 1/16 to get to this concentration. So it's actually 2 steps. So on this generator, you control the setting here, and then you have to control the oxygen tank. So you have a setting and an oxygen dial to get to a specific concentration. And it's just confusing. It's just an extra step that doesn't need to be there. That with this generator, you don't worry about it. It's just a single setting and it's so much easier. Also, just like how sleek and how beautiful it is. You'll see other generators that look scary, and I don't like scary looking things. They look like, you know, end of life like tools. Anyways, to each their own. I like this one. Does water help alkaline body? No. So ozone has nothing to do with pH. It doesn't affect the pH of our body. It's not acidic. It's not alkalinic. It's not one of the 5 things: inflammation, pathogens, mitochondria, immune modulation, oxygen. It's not one of those. It doesn't affect pH. There's so many things I could say. My mind just went into the map. You don't want to use alkaline water and ozonate alkaline. You want to just use regular filtered water. And that's because all of these little things that are in the water, the pH of the water, the osmolarity of the water, the ionization of the water, that all affects the ability for the water to absorb the ozone. So a salt water, saline, you can ozonate saline, but it's not going to absorb as much ozone because of the saline, the ion, the energy component of the water. It affects the ability for it to absorb ozone. So when you're trying to get a high quality water, you want to just use filtered water. No electrolytes, no salts, no minerals added, no alkaline water, no electrolytes, just plain filtered or distilled water. How long can you use the tubing for? So the tubing is typically made up of silicone, which is ozone resistant. Doesn't mean that it's ozone proof. Over time, it will break down. And my rule of thumb is until it gets cloudy or every 6 months. You okay? Are you bleeding? Put ozone oil on it. Oh, I wanted to talk about ozone oil a little bit. We talked about how you really don't need to be making ozonated oil at home. I really like this brand called Puro 3. And any type of oil will absorb ozone. It creates a liposome around it. But so when you see that there's a bunch of different options, there's jojoba oil, there's olive oil, there's hemp oil, there's sunflower oil, there's, whatever. It depends on what you're trying to use it for. So jojoba oil is my personal favorite because jojoba oil is the same. It's like the closest consistency of oil you can get to your skin. So the only thing I use on my skin is ozonated oil and Bees Wild Earth products. But other than that, I just use ozonated oil. And what feels the best is the jojoba oil. And then after you ozonate oil, you can then add other things to it. That's really important. But yeah, so you can buy ozonated oil with lavender in it, which can be helpful with skin, or like if you hate the smell of ozonated oil, getting one with lavender can just be nicer. If it's a wound, you're going to want an oil that's going to be a little bit less thin and more thick to kind of like adhere to the surface. I really like ozonated castor oil. Castor oil itself is like a miracle oil. It's really great for skin. It has a drawing effect. I use ozonated castor oil on my castor oil packs when I'm working on liver or any gut stuff, but it's really helpful for skin. So castor oil is a good option, except that it's really sticky and will ruin your clothes. So if you're not looking for that, but you need something a little thicker, then maybe an olive oil or the hemp oil is thicker too. Hi, Pete. And any other questions? Let's see. For ears and making water, do you fill up to the top or halfway? I don't ever fill it up all the way for the oil, just because like I feel like it's wasteful. Like all you really need is enough to fill over that bulb. And like I kind of go through it a lot, and so I just like to keep it low on the oil as much as I can. For the water, you can fill it. I kind of push it sometimes. There's a line that tells you how high to fill it, but yeah, I usually fill it all the way up, just because I will drink the water after doing like an ear insufflation, and it really doesn't make a ton. Promo Life has a water bottle flask that is bigger. I have one of those too. It's over there. But in it has it goes up to 1 liter of water, so you can make more at a time. Do you keep your ozonated oil in the fridge to do so it lasts longer? And what is the life of a non-refrigerated ozonated oil? It's a good idea to keep your ozonated oils in the refrigerator, and especially ozonated coconut oil because it will it discombobulates. I don't know if that's the right word, but I definitely keep my ozonated coconut oil in the fridge. I probably should keep them all in the fridge, but I don't. What I do is I just make sure that I keep it really tight, the lid on really tight. And I use mine so often that I honestly don't know, but I feel like it's a long time. As long as you keep it airtight, and definitely keeping it in the fridge will preserve it for longer. Oh, thank you, Elizabeth. I love to do teachings. Any other questions? Okay. I'm going to send y'all a feedback form where you can ask more questions. If you feel like you need some more assistance and you would benefit from a mentorship or a personalized, let's sit down and make a protocol for you, you can book a teaching consult with me or one of my staff members. And we love to help people use Ozone at home. So I hope this was helpful, and I hope that it empowered you and showed you how easy it can be. Yeah. If anybody wants to say anything, they can. I'm just going to hang around for a couple more minutes. Hi. I was just looking at Lindy and it reminded me about eczema. So ozonated oil is nice for eczema. It helps with inflammation. So it will can help be a good alternative to a topical steroid for treating eczema symptoms. It helps calm it down. Of course, eczema is there's something going on the inside, right? So it's not going to cure eczema, but ozonated oil helps lubricate the tissue and helps decrease inflammation. So it's been really great for eczema. Hemorrhoids, ozonated oil for hemorrhoids is freaking so helpful. Rectal insufflation will be like even more helpful, but ozonated oil is a good start. Hey, Seth. Yeah. What else? Somehow I messed up and joined at the wrong time. Please send the recording. Okay, I will do that. I will send out the recording. Where can I buy ozonated water? Some places do sell ozonated water. If you didn't see them make the ozonated water, it's probably not fresh enough. So you can purchase ozonated water from your ozone practitioner, and I would make sure that you watch them make it, because that means it's fresh enough for it to actually be an effective, high quality water. I would not buy ozone water off the shelf. Probably would, it's like nothing by then. The best way to do it is to make it yourself. We're just like at the very end of this Zoom call on Ozone at home. And so you guys just got an ozone generator at home.
No.
Have you been using it?
Yes, we've been doing insufflation in my ears and my nose. Yeah.
Cool. Yeah.
It's been awesome.
Was it scary? This is Seth.
Hello.
He's a massage therapist here.
Yes.
And he's
nice to meet
amazing.
you. Oh, thank you.
Yeah. So was it scary?
No, it wasn't scary at all.
Yeah.
She's been doing insufflations in my ears and then my nose. And yeah, the first time I was like a little weirded out by it, but it's not bad at all. It's pretty awesome. Like the results.
Never sensitive at all.
Good. Yeah. You
Sorry,
would
I'm
consider yourself like a sensitive person.
Very.
Yeah.
Yeah. Especially the first time I did ozone
IV.
I did have kind of like a Herx reaction.
I remember that. Yeah.
But the insufflations I've never had any bad experience.
That's awesome.
Yeah.
Yay!
We're so grateful.
excited.
Thank you. Yeah.
Oh my gosh, 1000%. B is his wife. Here she is, beautiful B. And I like, so she's a massage therapist, and a lot of times we were having your patients like do insufflations before or after a massage, because it's such a good combination therapy. And so I ended up just teaching B how to do it, because now that we have this like insufflation station and we're busy, and it's so easy like to teach you.
Yeah,
And
I was
so-
on the call. That's so
Were
funny.
you?
But I had
Oh.
to go to work, so I was like, I gotta go.
Aw.
Yeah, we love it. I did my ears when you started the call because I was like, oh, this is a great reminder to do my ears. Yeah,
Good.
I love it.
Yay. I saw your setup at your house when I was there. It's like,
It's so easy.
it's so easy.
So easy.
Yeah. Have you used it on your kids yet?
Mhm.
Yeah.
Yep, a lot. Especially if they wake up with like sore throat or just kind of like whatever insert symptom. I'm like, oh, let's just.
Yes.
And only my oldest has mastered the nose.
Yeah.
So
The nose.
that's been.
Oh, we didn't do the nasal insufflation. I didn't show the nasal insufflation. Okay.
I didn't.
We're going to do that another time, because
Okay.
it's like way past time. There's like not even that many people on here. Sorry. Shoot. Well, I'll make like a reel on nasal insufflation, but you have to hold your breath for like 7 to 8 seconds. Yeah. Do you want to?
I didn't do it.
All right, we're gonna do it then. Okay, so for nasal insufflation, I'm super conservative. I don't like to do high doses of nasal because it's not necessary, and it will burn your nasal passages if you do it too loud. So I just do setting 2, which is,
highest I've ever gone.
yeah, and you don't need more than that. I mean, some of our like ozone enthusiasts will come in and be like, give me 30 gamma.
Or I got that somewhere else and I want to.
I want to feel it.
that
I want to
again.
feel that again.
Yeah.
But
But
yeah,
less is more, I think, with the nose.
definitely. Okay, so I filled this up at setting 2, 10 gamma, 60 mLs. I'm gonna put half in each side. And I figured out the trick to these. Did you get these, Marty?
I still haven't gotten one.
Okay.
I'm gonna have to call.
Yeah. But I figured out the trick. You have to cut them to size. So they come with different things. So like you cut it to size and then they'll fit over. There we go.
New information.
Yeah. So, okay. So when you do the nasal, we're going to do one side at a time, and you're going to hold your breath for about 7 to 8 seconds. So when you're going underwater, you're going to and hold. Okay. Okay. You know. And then just slowly, like not too fast, not too slow, because obviously they're holding the breath. And then pinch both sides and exhale through your mouth. Perfect. And then you can let go, and you're gonna smell ozone instantly, which isn't always very pleasant. Some people hate the smell.
I love it.
I kind of hate it.
I like it. I do. Because I know what it is.
Yeah, I think that people that like need it love it. Yeah, it's
Mhm.
interesting.
We need to make sure it's need more ozone,
Yeah.
please.
Need more. Okay,
Okay.
so whenever you're ready, take a deep breath. Hold the breath. Perfect. Pinch. Exhale through the mouth. Keep it pinched for just a sec, and then you can release that.
I always close my eyes.
I do
think
too.
the direct eye contact
I use the
is,
direct eye
is like,
contact.
why?
I'm always like, feel free to close your eyes. It also affects the eyes. So like, I always tell people for an hour after insufflation,
Yeah.
like tingling, and sneezing, watery eyes,
Dripping.
nasal dripping. I always have tissues around. And I do it like at the end of the visit so that they can go home and experience all that. But it should only last for about an hour. And then, you know, just because as inflammation is going down, melting away, things flow. So thank you.
Okay.
Okay. Another question. I love swishing water for mono. Okay, this is one of my clients who recently had Epstein-Barr virus. If I'm correct, you had sores in your mouth, maybe? And that's why the swishing was probably really helpful. Again, anything you can bring closest to the tissue, the best. You can swish with the water. I started using ozonated water in my water pick to like floss my teeth with ozonated water. Amazing. I'll make ozonated water and put it in a bowl, a glass bowl, and wash my face with it. You can soak your hands and your feet if you have arthritis in ozonated water. I've heard really good things about that. Injection is really great, but bathing your joints in ozonated water, super helpful. You can even ozonate your entire bathtub of water. Ideally, you want it to be cold water, which is not a fun bath. Warm water doesn't absorb ozone very well, so it wants to be cold water. So do a cold plunge of ozonated water for your joints. Sounds horrible. I had a client who had a really bad skin infection and ozonated, I think, just lukewarm water, and said it did wonders. I think ozonated oil would be a great option too, but if you don't have that and you just had the ozonated water, that'd be great. Okay, my lingers. I love it. Y'all have any questions? Susan, did you get your machine yet? Amy has a machine. She's been using it. Leslie, I know. Kathy, Cameron, and Megan. If y'all have any questions, just let me know. I have to get off here in a couple of minutes. Susan's machine isn't here yet. Okay. When you get your machine, take it out of the box immediately. Otherwise, it might sit in your box forever. Take it out and find a spot in your home and start experimenting with it. Start filling syringes first. Start making ozonated water. You know, you can use the water, like plants love the water. If you're not ready to drink it yet, that's okay. Just start experimenting with it and start playing with it, because you're gonna wanna become comfortable with it. So as soon as you get it out of its box and start playing with it. Okay, y'all. Okay, I'm gonna go. This was fun. Y'all have a great day.